Dr. Shakib from Core Pelvic Floor Therapy in Irvine, Orange County, with my lovely lady, Christy, who is here for multiple things, including pelvic floor dysfunction. So Christy, can you tell everyone here about your story? What brought you here initially?
Originally I came for right-sided weakness. Was having a lot of pain and just difficulty using my right side.
So it was, we're not going to get into the reason why, but in the process we did the special neurology, postural neurology. We'll make sure that there's a link to that, and developmental kinesiology, functional movement exercises. And then we discovered my lovely lady has a weak pelvic floor, and that was something that I wanted to make sure you understand. Pelvic floor dysfunction is not always incontinence, though you did mention.
Right.
So in the process of examination and consultation and actually doing the different things that we did, we realized, oh, your pelvic floor needs a little bit attention. So we did the emsella chair, which is right here. In fact, you just finished another session of that. So in your experience with what we did, what are the changes, like wherever you were, if that was a dysfunction at, let's say 0, meaning it was the least functional way, and you have improved, what percentage improvement would you say you've had?
I would say it would be about 50%.
With the emsella?
Mm-hmm.
Okay. Yeah. So what was exactly your condition?
Well, first of all, I thought incontinence meant you just couldn't hold it and like you had to wear a diaper. So of course on the evaluations I was like, oh no, I don't have that problem. But learning through you, I learned that I retain it and I don't let it all go. Right. And I didn't realize that that was also considered incontinence. So.
Right, so that's technically overflow dysfunction of the bladder. So we did the pelvic floor, specifically Kegel exercises, which this machine does 400 of. So, so in the process, after about how many visits, how many times of this did you say? About 3? Was it after the third one?
3.
So when you came in on the third one, which was actually the second week, because the first week was 2 visits of this, the second week is when, that's a third visit, is when you notice,
yeah, it was a lot easier. And then just being more aware too, like, oh, okay, yeah, it is easier and better.
Yeah, lifestyle change.
Yeah.
Anyway, I just wanted to thank you for sharing your story here. We're gonna continue on, so maybe later on you can tell us more about what exactly your treatment was like from a patient's perspective. Mm-hmm. At any rate, pelvic floor dysfunction is more than incontinence, just like you came in with issues that pointed towards the dysfunction, and we did the pelvic floor treatment with the emsella. I encourage you to visit my website and subscribe to the channel, and thanks for watching.